Welcome to the Mental Health Questions You Always Wanted to Ask webinar. Today we'll hear from an experienced psychologist who will answer many frequently asked mental health questions. I'm Kristen from Lumino Health, and I'll be facilitating today's session. Now I'd like to share a little bit about Lumino Health. On the Lumino Health website, you can search and connect with local healthcare providers. On Lumino Health, you'll also find articles and resources that will help you manage your health. Today, Lumino Health is pleased to present this webinar with Beacon. Beacon Digital Therapy provides care of a range of mental health issues, including mild to moderate symptoms of depression, anxiety, and PTSD. Beacon therapists are registered mental health professionals who have helped Canadians from coast to coast. With me today are Dr. Peter Ferelden and Katie Werndl from Beacon. Today, they're going to walk us through some of the questions that they've received over Beacon over the years, and will be answering those questions for us. Welcome, both of you.
Thanks, Kristen.
Hi, everybody.
Before we begin, I'd like to share a little bit more about Dr. Peter Farvolden, who's with us today. He is a clinical psychologist and leads the clinical team at Beacon Digital Therapy, and has previously held positions at Center for Addiction and Mental Health and the University Health Network. So we really look forward to hearing his answers to a lot of these frequently asked questions about mental health.
Thanks, Katie.
As Kristen mentioned, today's webinar is about mental health questions you've always wanted to ask. And these are questions that our Beacon clinicians have been asked over the years. We'll also be answering questions that have been submitted through Lumino Health social channels at the end of this webinar. So without further ado, let's go ahead and get into the first question that we have here, which is, what is a mental illness? We've all heard of depression and anxiety, but what does it actually mean to have something like that?
Well, we use the term mental illness to distinguish significant problems from normal responses and to normal everyday life events. So on the one hand, we all have normal emotional responses to everyday life events. If those responses are too extreme, or they persist for too long, or they cause significant interference in functioning and distress, then we call it a mental illness.
That's interesting, Peter. So we don't necessarily want to call something an illness if it really is a normal reaction to a life event.
So that's right. So on the one hand, we probably need labels so that we can identify problems and get people to appropriate evidence-based treatment for their problems. And then on the other hand, we don't want to pathologize every normal emotional response to life events. So even, for example, in post-traumatic stress disorder, there's a good argument that we shouldn't call it post-traumatic stress disorder. We should call it post-traumatic stress response, because it is a response to extreme events.
All right, so now that we know what a mental illness is, let's move on to our next question that I'm sure a lot of our listeners can relate to, which is, you know, we all go through periods of feeling down, but what exactly is the difference between having the blues and actually being depressed?
So that's true. We all know what it's like to feel sad or down. We all know what it feels like to feel disappointed or left out, to feel rejected. We all have these experiences. We all have these emotions. So depression is about feeling sad and blue and down, but it's also much more than that. Depression is about feeling that way persistently for 2 weeks or more, so not just a day or two or a bad week. And it's about having other feelings and experiences as well. So depression is about sad, but it's also about a lack of motivation and interest, a lack of sense of pleasure, changes in appetite and sleep, anxiety, irritability, and hallmark symptoms are hopelessness and withdrawal from other people.
So just because I've had a really tough week at work and have been feeling really down on myself doesn't necessarily mean I have depression or am at risk of developing depression.
That's right. We all have those experiences and we all have those responses. What makes it more likely to be depression is if you're having that experience it persists. You're having that experience for like 2 weeks or more, and you have these other symptoms as well.
Mm-hmm. And what if someone is listening to this and is thinking that they really have had those persistent feelings of low mood or lack of motivation or withdrawal from others for, say, a few months now? What can they do to go and get help?
So if somebody's been feeling that way for a couple of months, I would encourage them to reach out for help. If you're struggling with depression, that is a tough journey to be on by yourself. And although there's still lots of shame and stigma about reaching out for help, I encourage people to do that. So if you can, reach out to somebody who you trust, a family doctor, your EAP, your local Canadian Mental Health Association chapter, a friend, a family member, and ask them to help and start to get the help that you need.
That's great. And now that we've talked a bit about mental illness and what it feels like to have a mental illness and how to get support, I do want to now spend a bit of time separating fact from fiction, particularly when it comes to what actually causes mental illness, as I know that's what a lot of our Beacon clinicians get asked all of the time. So many believe that things like drugs and alcohol, let's say, really impact someone's mental health and can cause a mental illness. Is there a safe limit, or is there some kind of tipping point to avoid here?
So substance use can result in other problems, including mental health problems. On the one hand, across all human societies, people use substances to relax. We use substances to connect with other people. For example, in North America, Western society, we use alcohol in that way. And there are safe drinking guidelines, for example, from Health Canada. Recommendation is for women, no more than 10 drinks a week, no more than 2 drinks a day most days. And for men, it's 15 drinks a week, no more than 3 drinks most days. So there are safe drinking guidelines. On the other hand, we know from the research that alcohol is the single biggest destroyer of lives in North America. So on the one hand, there are safe guidelines. On the other hand, we know there are risks associated with any substance use. You know it's becoming a problem when the urge to use the substance becomes the main thing, and it starts to override other priorities and things that are important to you in your life. Then you're moving into a substance use disorder or an addiction. And the other way that people get into problems with substances is when they start to use substances to self-medicate, for example, for a mood and anxiety disorder. And then the short-term solution develops a life of its own and becomes a part of a bigger problem.
I've also heard that things like social media can cause anxiety. Is that true?
So the research so far on social media is a bit murky, but I think the rule of moderation probably applies. The research to me seems to say that using social media a little bit is okay, and then using it any more than a little bit can lead to people feeling more isolated, more anxious, more depressed instead of more connected with other people. And I think there's probably a couple of reasons for that. One is that we're hardwired so that we find it hard to not compare ourselves to other people. And social media, we see other people living the best version of their lives. They're doing exciting, fun, often fantabulous things, and we're leading our own normal everyday life, and we can't help but feel less than what they're doing. And then the other issue is that we're hardwired, I think, to be very sensitive to being excluded or ostracized. And I think there's something about social media that can lead us to feel excluded or ostracized instead of included. And that can lead us to feel anxious, depressed, and maybe even angry instead of connected.
So what I'm hearing is that, like drugs and alcohol, moderation with social media is absolutely key. What about things like genetics? I have heard that mental illness can really run in the family. So is it true that if I have a relative with a mental health concern, I should also be worried about developing one too?
So it is true that genes play a role in mental illness. However, the research is pretty clear that the amount of contribution, the variance that genes contribute is very small. So even for problems like psychosis and bipolar disorder, there's a genetic contribution, but it's a small contribution. Far more important are factors like early environment, your childhood and adolescence, and then the interaction between our genes and the environment.
So while genetics are a little part of it, what I'm hearing is that environmental factors are very much a primary contributor as well.
Yeah, that's what the research says for sure.
And with all of these factors that can contribute to developing a mental illness, like genetics, environmental factors, drugs, alcohol, and even social media, as we mentioned, is there something I can do or we can do to protect ourselves from developing a mental illness?
For sure. But first, I think it's important to accept that there are some things you can't change. So you can't change where you were born or who your parents were or whether you had access to medical care or nutrition or schooling. There's all kinds of things that you can't control, and you also can't control whatever happened to you if you were exposed to trauma when you were younger. So I think an important part is to accept that there are some things you can't control, and then to commit to controlling the things going forward that you can control. So for example, the research is very clear and overwhelmingly clear that one thing you can do is build meaningful social connections to other people. So the single best thing that you can do to increase your resiliency is to have meaningful social connections with other people.
So social connections, meaningful relationships are definitely key. Are there other things we can do to better our mental health?
So for sure, there are other things you can do. So for example, you can try to eat well, you can try to exercise, you can try to sleep well, and you can use cognitive behavioral therapy techniques to increase your resiliency and manage stress.
You mentioned CBT, or cognitive behavioral therapy, which I know is your particular area of expertise, and it's also what Beacon Digital Therapy is. Are you able to share a little bit about how CBT can help a mental illness?
So CBT is evidence-based psychotherapy for common and not so uncommon problems. There are other evidence-based therapies, but CBT is the one for which we have the most evidence. And the premise of CBT is that with some practice and guidance, you can develop a different relationship between you and your thoughts and feelings and behaviors. So with respect to thoughts, you can learn to relate to your thoughts in a different way, sometimes by challenging them, sometimes by accepting them, and then you can experiment with new ways of behaving and thinking about stressful situations.
And before I hand it back to Kristen for questions from the Lumino Health social media, I do have one last question for you, Peter, which is, is it actually possible for someone with a mental illness to completely recover?
So absolutely, and that's important to know. So many people with mood and anxiety disorders completely recover. They experience a problem, they get effective treatment, and they completely recover. Even people who have problems that are supposedly harder to treat, like OCD or PTSD, even people who experience a manic episode or a psychotic episode, can get treatment and live a very full life. The goal of treatment for all problems should be symptom reduction to remission, which is like an absence of symptoms. And when you do that, you minimize the chance of relapse.
Great, thanks so much, Peter and Katie, for walking us through those really important mental health questions. Now we're going to go over and answer some of the questions that Katie mentioned we received through our Lumino Health Instagram channel. What are the most common types of mental illness, and how would you feel if you had one?
So by far the most common types of mental illness are anxiety disorders and depression. And they often overlap, so people who are depressed often have a significant amount of anxiety, And anxiety disorders are often associated with depression. So, for example, most depressed people report significant anxiety symptoms. And then people who are living with anxiety disorders are living often with a chronic relapsing health condition, their anxiety disorder. And so like other people with chronic health conditions, they often get depressed as a result of having a chronic health condition. People who are depressed have those feelings of feel sad, lack of motivation, lack of interest. They also experience changes in appetite, changes in sleep, and they can also feel irritable, angry, and anxious. People with anxiety problems fear and avoid situations. They experience anxiety and worry. For specific anxiety disorders, they're anxious and worried about fairly specific things. So for example, people with social anxiety are anxious and worried about social and performance situations, whereas people with panic disorder are anxious and worried about having a panic attack. People with more generalized anxiety disorder are anxious and worried, they say, about a lot of things, or they worry about everything all the time. So they feel anxious and worried all the time. A really anxious person will walk around with a feeling of doom as if something terrible is about to happen. And people with anxiety disorders can experience panic when they're faced with thoughts or feelings or situations that make them anxious. So depression, anxiety is the most common kind of problem, and you get mixtures of symptoms of depression and symptoms of anxiety.
Okay, great, thank you. Now on to our next question. So burnout is now recognized by the World Health Organization. So it's getting a lot more attention than it used to. So what is burnout? Are the symptoms different than depression? Can you tell us how they're different?
So burnout is not a psychiatric diagnosis, and burnout is about the workplace. If you think about being happy and healthy at work, it's about approaching your work with interest and engagement, right? Mm-hmm. Burnout is the opposite of that. So burnout is about having a feeling of exhaustion and a feeling of lack of interest, a lack of engagement in your work, and a disturbance in your identity. So work's important to most people. It's an important part of their identity. When people are feeling burned out, they don't feel connected to their work. And that can certainly shade over into depression. So burnout's about you and your work, but if you're feeling detached, disengaged, a lack of energy, if you feel exhausted, that can start to shade into depression for sure.
Okay, great. Thanks, Peter. Now, our next question, what is the difference between depression and postpartum depression? Are they treated differently? Can postpartum turn into depression? So that's a three-parter.
So giving birth to a child is a major life event, and like all major life events, no matter how happy it is, it can be really stressful. So a lot of new mothers, after giving birth, it's normal for them to experience the baby blues for a period of 2 weeks or so. Often it begins 2 or 3 days after they give birth, and then it lasts for a week or so. Normal reaction to a major stressor and giving birth. People experience mood swings, anxiety, sadness, or tearful, and then it goes away. Postpartum depression is when that persists, so 2 weeks or more. Baby blues usually are less than 2 weeks. If those symptoms persist for 2 weeks or more, then that can be postpartum depression. It is depression like any other, so there's no difference between postpartum depression and other depression. And people can also develop significant anxiety postpartum, symptoms of OCD, not unusual. And it's extremely treatable, so like other forms of depression, with appropriate treatment, people feel better, and they get back to connecting with their kid the way they want to.
Excellent. Thanks, Peter. How are bipolar disorder and borderline personality disorder different?
So that's a good question. So let's talk about bipolar disorder first. So bipolar disorder is formerly known as manic depression. Bipolar disorder is a mood disorder that's characterized by mood swings from depression. So depression is feeling too bad for too long, and mania, or a lesser form of mania, which is hypomania. And you can think about mania as often it's about feeling too good. So the depressed phase of manic depression looks like depression. People have the symptoms of depression, often in a profound way. But then they can also experience mania, which is, it has a driven quality, so they have high energy. Typical symptoms is a person with mania doesn't need to sleep for 3 or 4 days at a time, and they're not tired. They're euphoric, grandiose, and they engage in risk-taking. The mania or hypomania is often, while it can be euphoric, it can also be irritable and angry. And what happens is people have that phase and then they go into a depressed phase again. So it's a periodic, cyclical problem. It's very mood-based. It seems very biological. And it doesn't seem to be particularly tied to trauma. Borderline personality disorder, on the other hand, is also characterized by irritability and impulsivity and mood swings, but the cause is different. Borderline personality is about childhood and adolescent trauma, and it's about people having a very undeveloped sense of self and difficulties with attachment. So people with borderline personality disorders have a great fear of being abandoned, and that fear affects their lives in various ways. They are, and causes a great deal of trouble in relationships because of irritability, impulsivity, anger. And unlike bipolar disorder, which is cyclical and episodic, borderline personality is kind of always on.
Okay, great. Thanks, Peter. Okay, so our next question is, where do panic attacks fit in with mental illnesses? Are they a symptom of depression or anxiety or even PTSD? Or can someone experience a panic attack without having a mental health issue?
So in fact, all of the above. Panic attacks are associated with a lot of stress-related problems. So majority of people, maybe 70% of us, will experience a panic attack or two in a time in our life that's really stressful. Panic is often associated with the onset of depression. I think often because when people get depressed, it's because some stressors have accumulated and they're in a crux. So panic attacks are often associated with the onset of depression. Panic attacks are associated with panic disorder. So if you experience a panic symptoms and you kind of know where it's coming from, so for example, if you're up on a ladder cleaning the eaves and the ladder starts to move, or if you're almost in a car accident, or if you're on a ride at Wonderland, you can experience symptoms of panic and you're not afraid of them because you can attribute them to something that's scary. People with panic disorder experience a panic attack out of the blue for no apparent reason, and that makes it really frightening. So your body's reacting with this extreme fear response and you have no idea why it's doing that. That's panic disorder.
And for those of us who aren't aware, what does a panic attack look like?
So a panic attack is a sudden, intense physical experience of anxiety. So again, it's that if you've ever had a fear experience, then you know what the start of a panic attack feels like. And common symptoms are racing heart, palpitations, shortness of breath, feeling dizzy, feeling hot or cold, feeling numb, tingling. A very common symptom is feeling like the world is unreal, symptoms of depersonalization and derealization.
So some of those symptoms sound pretty scary. Can some of them be confused for other health issues, let's say a stroke? And if you're with someone who's having a panic attack, what should you do? Should you be calling 911?
So that's a good question. If you experience intense physical symptoms that you've never experienced before and you don't know what they are, so you think you may be having a stroke or a heart attack, then I would encourage you to seek medical attention. And I think you want to do that for a couple of reasons. One is that although panic disorder is treatable, it is hard to treat panic disorder on your own. So if you have panic disorder, then you want to know what that is so that you can get the help you need, right? So you want some professional help identifying what it is. And then secondly, the symptoms of panic are the same as the symptoms of having a heart attack or having a stroke for many people. So if you're not sure, then I would encourage you to seek medical advice up to and including 911.
So there's lots of great work being done to remove the stigma around mental health, but for a lot of people, it still can be an embarrassing problem to have. So if people want to start by helping themselves, like what kind of resources should people be looking to?
So there's been a lot of great work done over the last 10 years by lots of people to reduce stigma, and that's all great. But there's still a lot of shame and stigma about getting help for mental health problems. And fortunately, there's 40 years of research on self-help. We know self-help works, especially for common problems like mood and anxiety disorders. However, we also know that self-help is really hard, so it's hard to do it on your own, and that it works much better if you have a little bit of therapist guidance and support. So the research is out there, and that's partly what led us to develop Beacon. So there are resources out there, there are great self-help resources out there, but we know that these resources work best if you have a little bit of therapist guidance and support. There's 20 years or so of research on that.
What are some other steps that people can take if they're ready to get mental health help?
So if you're ready to get help, then I encourage you to reach out. Reach out to your family doctor, your EAP, Canadian Mental Health Association, reach out to friends, colleagues, family, and don't stop until you get the help that you need.
Great, and we have one more question. So what can I do as a friend or family member of someone who's struggling with their mental health?
So I like to think of the acronym OARS, OARS. So if you're approaching talking to somebody who you think has a mental health problem and you want to help, the O is for observe. So start the discussion by talking about what you're observing. Don't jump to conclusions. Don't come straight off the bat with advice or a solution. Start out with what you're seeing. So I noticed that you're behaving in a certain way. Keep it about behavior. And then the A is for ask and actively listen. So ask the person questions and listen for what they're telling you. Take the time to be patient, to ask them what's going on for them. The R is for refer. So refer them on to resources that seem appropriate. And the S is for support. So circle back and support them and check on them and see if they've started to engage in any help-seeking behavior. These are often awkward, difficult conversations for us to have with people. We tend to avoid things that are awkward and difficult. So the other advice is don't put it off. If you want to help somebody, help them now. Don't wait for the perfect time. And don't wait for you to be able to do it in a perfect way. So the research and the experiences is just being available to people, being available to listen and support people when they're struggling is the most important thing that you can do, and you don't have to do it in a perfect way.
Wonderful. Thanks so much for that, Peter. That's all the time we have today. So I want to thank Peter and Katie for joining us from Beacon, and thanks to everyone who joined us today for the webinar, especially those who sent in questions on the Lumino Health social media channel. If you want to learn more about Beacon, you can visit luminohealth.ca and visit our Discovery Lab. You'll find Beacon in the mental health section there. You can also find other mental health resources on Lumino Health at luminohealth.ca/mental health. Thanks again for joining us.